النهارده فينا البرايمال imaging. طبعا we start with the parathyroid. We've been talking about the parathyroid, and because the parathyroid glands are very small in size, they are variable in number, they are variable in location, and because we don't want to expose someone with hyperparathyroidism and then keep exploring the neck and eventually not identify the parathyroid adenoma, which is the most common cause, but it may well be a hyperplasia. Obviously, a preoperative localization is very important so that your exploration becomes targeted to the adenoma that you've already identified. Imaging techniques will not show hyperplasia, they will just show adenomas. طبعا adenocarcinomas are for technical purposes out of your scope. They do not exist in the first place. طبعا they exist, but they're really very rare. دلوقتي لو نطلع شكلنا كده يبتدي لنا عائشه مشكله ان جيت النهارده بجد. عائشه كان عندها يعني جت رغم الصعوبات. فمين دلوقتي هيطلع يشوف لنا الصور دي؟ Okay, go on. Yalla Pradeep, go on. We are going to start with the parathyroid imaging. Well, parathyroid is something very special about this imaging because ultrasounds, CTs, MRIs, and X-rays obviously are not very useful. The imaging modality of choice is a CT scan. The CT scans اتفقنا ان هم بيبقوا بيستعملوا. Whenever we talk about the CT scan, you need to obviously to mention or emphasize the radiopharmaceutical that you're going to use. Radiopharmaceutical may be one substance that is specific to the organ in question, and the other that is radioactive, that emits obviously gamma rays. فيلا بقى قول لنا what is going on.
This is a CT scan of thyroid.
Of the thyroid. One very important aspect of interpreting an image is to comment on the image. The image itself, you need to read all the data around you because they're there. انتوا عارفين دايما بيقولوا there are so many signs that you either identify as a sign or not as a sign during your lifetime even. يعني signs كتير موجودة بس who cares? Who identifies them as a sign? Can you see something different? Can you see something different written there? Because you need to check the name. One very typical snag is to interpret, to review someone else's images when you're reviewing a different person. It's not uncommon that you're going on the ward round and you've got the images of someone else. So one golden rule is when you're on the ward round, you never talk about another individual. You just talk about the individual you're reviewing. Otherwise, things become mixed up. It's not uncommon that you take a few images to the radiologist and you're debating how these images belong to this individual, and they turn out to be, they check the name and this is not the name. But it's very important to check the name, the date, the center, who reported the image, what form of imaging is it, which modality, which projection, which contrast, if at all, and obviously if there are any signs or arrows, because radiologists know that clinicians are much less knowledgeable about images. أكيد طبعا clinicians will review a few images a day while radiologists will review maybe hundreds of images a day. واضح الفرق يعني أكيد. So they've got a more experienced eye. لما بقول لكم imaging from a surgical perspective, because I cannot claim to present images from a radiological perspective. It would be very absurd to do that. But I'm presenting these images from a surgical perspective rather than from a pure radiological one. Well, what can you see there?
This is the Passenger Saima Abdul Khalas.
You shouldn't be saying her name in full because then this is a breach of confidentiality. You should just say initials. You shouldn't be talking about people mentioning their names in full, otherwise you're breaching confidentiality. We just mentioned the initials, S.A. Whatever her name is. Okay, but this is not, okay, she is a woman. You need to note the gender because the gender may have an effect on diagnosis. Obviously the age if available and so forth. The ethnic group, if at all possible. But what lies there?
And it shows thyroid anterior parathyroid.
This is a parathyroid CT scan. It's not a thyroid CT scan.
It's parathyroid.
ودي عشان كده it's very important to start interpreting the image itself. Approach to the image, approach to the findings, approach to the diagnosis. تمام؟ على فكره الكلام ده انتوا واخدين عليه انه ايه؟ طب هو بيقول كده، طب ما يقول، بس هو فعلا it's very very important. There's an approach to the image itself. انتوا مدين انا قاعد؟ يبقى there is an approach to the image itself, which means that you want to know who was imaged, and when were they imaged, and where were they imaged, and how were they imaged, يعني how, which modality, in which projection, with contrast or no contrast, whether there are many arrows. You should interpret the images not through daylight but over a viewing box, because obviously a viewing box concentrates the light. Daylight is not comparable to any other form of light, but because you need a bit of focused light, you cannot interpret the images without light, because otherwise you will not see a lot of things that are seen over a viewing box. Orientate the image properly, orientate it, right, left, مش عارف, superior, inferior, and so forth. While then start interpreting. You may find it a normal image. Whenever you're judging something, it may be normal, maybe pathological. There may be evidence of a previous intervention, whether it's open, whether it's whatever, many invasive, you may find simply evidence of the technique to which the image was done, like a catheter inside an artery, like, I don't know, whatever, it may be. And then أربع possibilities. It may be normal, there may be evidence of the technique of the imaging method, there may be a pathology, or there may be an intervention. You need to review the normal before you review abnormal, because you need the standards to our reference point. اتفقنا في radiologic anatomy واسمه Abraham اللي you are not becoming a radiologist at the moment, but you may become one. You just need to look at the images before you go to sleep in the middle of the night or in the early whatever. يلا قلنا parathyroid, thyroid.
This is up from parathyroid, and it shows a hot nodule in the neck region, and this may be submandibular gland.
Okay. These are salivary glands. You shouldn't be worried about them. You should just know that they also take the substance that is taken by the thyroid, that is technetium, IV, both. Why is the whole body sort of showing hot spots like that? It's not as hot as the thyroid and the parathyroid area. Why is there a sort of radioactivity all over the body?
Maybe because the bone is also taken.
Is this the bone? Do you think that this is the bone? You've seen a bone scan before. You've already seen a bone scan before last week. We'll still see these things much more than you imagine. يعني نشوف الحمد لله a chunk of images over the sessions. واحنا مرة بنعمل systems، مرة بنعمل modalities. نعمل هم 16 modules: CT, MRI, ultrasound, X-rays, I don't know what, ultrasound, then and the pediatrics, and then the systems. احنا بنعمل حاجات الحمد لله مرتين. Systems as in neuroimaging, مش عارف head and neck, thyroid endocrines اللي بنعملها دلوقتي, the heart obviously, which I almost passed by very quickly, the chest, orthopedics, the urology, the GIT. We'll go on. What is the first image? First image, AD.
This is a hot nodule of parathyroid.
Does this look like a parathyroid? Does this look like a parathyroid?
It's maybe single nodule, solitary.
Does this look like a parathyroid, or does it look more like a thyroid? What do you think?
It's more like thyroid.
So this is the thyroid. This is the thyroid. This is a technetium scan of the thyroid. And then you can see the image in the lower row. What's happened in the lower row? What's happened? Can you identify the site of the thyroid?
No.
Why can't? This is the area. And how does it look? What density or how would you describe this area in CT scan terms?
It's a cold.
It's cold. The thyroid is gone.
Yes.
While the thyroid in the upper image was really hot.
Yes.
What happened? What did you do to the image? what did you do to the image? Do you think we've been mentioning that? We've subtracted it. We've subtracted the images. The subtraction image. The subtraction, so that there's almost always a gap between what you know, simply know, and what happens in reality. عشان كده, if you've been staying in the hospital for a while, the gap becomes sort of bridged. The gap diminishes. وزي ما بيقولوا mind the gap. لما يقولوا مش عارف انهي قطر كده يقولوا mind the gap because there's a gap between the train and the platform. فبيقولوا mind the gap. So mind the gap. You should mind the gap, but not the platform gap, the knowledge gap. So work on your gaps, and then the gap here between what you read and you did not see, and what you've already seen or done or already explained, for example. So this subtraction images can be subtracted or subtracted. Both are correct. They can be fused. You can fuse images together, or you can subtract images. Subtracted. The thyroid is gone, but what remains is there's a hot spot remain within the subtracted image. The hot spot. Can you see a hot spot in the lower part? In the lower row. Yes. Can you see this hot spot there? This is the hot spot there. So this is a parathyroid adenoma in the left inferior parathyroid. This was the thyroid, and you can see that with the image on your right hand side, not the image is right hand side, your right hand side, there is something that is increased in the lower pole of the left lobe there, and then when you subtracted it, it remained as hot spot. The Italian technician subtraction scan.
Doctor, ما يقصدوا ايه anterior parathyroid؟
Anterior, just the anterior.
مش هما superior و inferior؟
لا هو anterior يعني projections anterior, because with these images you can take an anterior, you can take a posterior, you can take an oblique. طبعا biplanar imaging is really bad because it reduces the thickness of the body that is 3 planes into 2. It's very, very bad. It's very bad because the body does not consist of 2 planes. It consists of 3 planes. You reduce the 3 planes into 2 planes, and then things may be missed because things may appear normal in front and behind, and the thing may be very small so that it can be missed within the normality. But this is why you tend to take different views. If you see something, if it's an anterior projection, you see something there, is it close to the trachea or is it close to the vertebral column? You need the lateral view in order to assess its depth. دي حاجة قلب بيه في الimaging, unless you're taking a 3-dimensional thing, which is almost always reconstructed.
Doctor, this is the thyroid.
This is the thyroid. This is thyroid and parathyroid because you can see an increase in the lower pole of the left lobe, which is not the thyroid in actual fact, because when it's subtracted, the thyroid is gone, and then their hyperplasia does not show on a CT scan. They don't show. Hyperplastic glands will not show. They're only the adenomas that will show. When we're talking about an adenoma, but adenomas are fortunately the most common manifestation as a cause of primary hyperpar, which is solitary one, which makes the procedure much easier. Because then you target this inferior left parathyroid, you'll not explore the whole neck. You need not do that. You'll explore the whole neck if it's hyperplasia, then you're looking for the 4 glands, and obviously you leave one behind and then you remove the others. Okay, if you want to make sure that what you've removed is the parathyroid, you get a frozen section intraoperatively, checking that this is parathyroid, and you can check the level of the parathormone because of its very short half-life. You get a parathormone level and it drops after it's been high, I don't know whatever its level.
وحضرتك قلت ليه البادي كله صوته في هوت كده؟
Has anyone got an explanation why is the whole body? Well, it's not hot. I mean, it's emitting a bit of gamma rays.
ما خدش التايم كويس ان هو
ايه؟ ما خدش التايم. هو بتقول ايه؟
هو شارب سكين ممكن.
مش سامع.
ثانيا سكين.
Because it reaches the whole body through the blood. بيقول على background radioactivity. بيقول على background radioactivity. It's natural. You don't expect the rest of the body. You're targeting one organ, which is the organ in question, but the whole body will also show a bit of radioactivity. وفي areas that are well known to be to possess a higher background radioactivity than others. في background radioactivity. The terms that you use, what are the terms that you use in order to describe lesions on the CT scan?
Hot, cold, and warm.
Hot, cold, and warm. And this is a gray scale. The gray scale. I mean ده انا قاعد بس انا عندي النقطه دي. يعني اتعلمت اقول ان انا عندي حاجات مضايقاني، هم حطها لها بوكسز وحطها في الستورج اريا وعدي. فانتم مضايقين؟
So Doctor, this is just I'm reading the view only. It doesn't mention that it's adult.
I don't mention it what?
I mean, it's just a view, not the organ itself. I mean, this
Well,
is
it says parathyroid, thyroid. It says parathyroid. This is parathyroid, thyroid.
Okay, this is para and this is thyroid.
Yeah, this is
It's not the parathyroid.
Sorry?
I mean, just it is not the one name, yani parathyroid. I thought
Because it's a subtraction scan. It's not a parathyroid scan. A parathyroid scan is a media scan. This is not a media scan. The Italian technician. The thyroid, parathyroid. There are two methods to CT scan the parathyroids. The parathyroids are problem identifying them intraoperatively. If you're a nuclear surgeon and you operate upon the parathyroid frequently, your eye becomes very experienced in identifying the parathyroid. At times, they say that the eye of an experienced surgeon is the best method to localize and identify parathyroid. If you're an occasional parathyroidectomist, then there's a problem. But if you're a high volume surgeon, يعني you operate upon the parathyroid daily or I don't know what, then it's very easy to identify it. You're very confident identifying it as the parathyroid. If not, then not. It's got a very nice maroon colored. Maroon, اتفقنا على chestnuts and the thing that you sort of مش عارف you make it really full of sugar and then they call it مش عارف ايه sugared معروفين. Chestnuts if you after chestnuts and you heat them during the winter months and you eat them while it's very cold, chestnuts and the thing inside them, how it looks like, it's got a very typical yellowish brown or brownish yellow color.
Doctor, this is digital subtraction, right?
Pardon?
This image is digital subtraction, right? This image.
Yeah,
Then
what?
why not? I mean, these
معرفش مش عارف. I don't know why. I don't know. مش عارف. You just subtract the thyroid and the parathyroid. You don't subtract the whole image. You just subtract the thyroid and the parathyroid.
Okay.
But this is just a deduction. Okay?
Okay.
Thus it's clear how the thyroid area is already totally cold. ما فيهاش أي حتة خالص warm. أقول.
يعني انا شفت الصوره اللي فوق على اليمين دي، قلت مثلا دي ثايرويد وفي كولد نوديول اللي هي بتاعها على الشمال ان في ميسنج اريا. هو احنا عشان عملنا بس السبتراكشن دي وبين
طب ما هو في واحدة تانية قبلها هي موجودة ما فيهاش الاريا that is protuberant from the lower pole of the left lobe. في واحدة الأول أهي.
ما قصدي لازم تبقى سكشنز عشان اعرف اساسا ان الكبيره دي الباراثايرويد ولا ممكن
It has to be subtracted. You cannot know that it's the parathyroid. You deduct or you reduce it is, but you have to subtract it. In order, if it were not a parathyroid, it would have gone. If it were the thyroid, it would have gone. There wouldn't have been this cold nodule in the lower pole of the left side. Point to the nodule that is remaining. Point to the region. It's there. It wouldn't have been there. The whole thing would have been cold. You subtract the thyroid with the technician and the thyroid with the thallium. If there's a parathyroid that is taken thallium, that is an adenoma, it's only the parathyroid that will remain. ودي بيسموها gray scale. Gray scale يعني depicting things. Depict, عارفين depict? Depict يعني depict. يعني show. Depict يعني show. Very commonly used بقى. Yesterday we were discussing someone's thesis. ولو كنتوا تشوفوا the amount of spelling mistakes و grammar mistakes و reference mistakes و formatting mistakes كنتوا تقولوا ايه احنا كلنا مجانين. I'm not joking, it's no joke. So when you write something, revise it thoroughly. Let someone else revise it. It was disastrous. ليه؟ لأن محدش خد بس الeffort انه revise spelling mistakes, grammar mistakes, so what? We're not talking only science يعني. formatting mistakes, reference mistakes. محدش عارف يكتب references ضعيف قوي او مش محدش عارف. No one is people are too lazy to revise things. ضعيف قوي قوي قوي. وريبورتس بتطلع كده على فكره. If you read radiology reports, they're very it's very sad. Loads of mistakes. If you become whatever you will become. ايه؟
department books نفسهم they have mistakes.
خلاص ما هو it reflects what we are. بس ما حاجه بسيطه يعني. اقول it only takes we accept mistakes. واي text هيبقى فيه mistakes. بس the more you revise and the different eyes the lesser the mistakes. The lesser you revise and the same eye down you become accustomed to the mistakes by the way. And the further you read the more mistakes you identify. And if other people read the more mistakes they identify. ده عادي يعني. ساعات الواحد يقعد يقرا يقول بقى ولا غلطه حد هيطلعها لي. يعني يا نهار ابيض في اول قرايه كده يطلع غلطات ثانيه وطبعا اللي قرا كتير هيبقى متغاظ جدا انه وبعدين طب ايه المشكله يعني. When you write something and it's your own or not your own, just revise it thoroughly because it sort of conveys a message about us. ما هيش كده رساله وخلاص، ما هي رساله وخلاص، ما هي زي ما بيحصل. The cumulative effect of these things is disastrous because this becomes the norm. بقى ايه المشكله؟ ما الرساله عامله كده، ايه المشكله؟ وكل حاجه عامله كده، ما ايه المشكله؟ النور بتقول الكتب عامله كده. Okay, it's gone. انا بعتذر مره ثانيه ان انا قاعد. This image is gone. You can subtract things, you can fuse things. If you become a radiologist, you read a lot about techniques that is out of the scope of these sessions طبعا. This is just an introduction. مهما عملنا, this is just introductory, but it helps you create a foundation for you to build whatever you want later on. You can fuse things, subtract things. CT scans depend upon the emission of what do they emit, what do tissues emit if they've taken the substance. Gamma rays. Gamma rays are they're rays, they're not particles. They don't emit beta particles, alpha particles. If they do that, they destroy. But these do not destroy. طبعا they irradiate the tissues, أكيد. But they use very minimal amount of substances and they never cause an allergic reaction. And when you give contrast in radiology, you're worried about IV طبعا. You're worried about an allergic reaction. But to this, you never worry about any because they're given very small amounts. And they're very sensitive. They're very sensitive. Sensitive يعني ايه؟ If they're negative, they're negative. They never show a false negative. They cannot show a false negative because they show everything. But they show everything in the same way, but they're not specific. عارفين الكونسيبت بتاع sensitivity or specificity. The sensitive means that there will never be a false negative. If it's negative, it's negative. X-rays are not like that. If you get an X-ray for the bones, for example, maybe negative or there's something. But this something is shown on CT scan, but this something that is shown can be anything. X-rays are specific, but CT scans are very sensitive. They'll never miss. They'll never miss. Okay? But X-rays are specific, not sensitive. خلاص? I hope that this is quite clear. أنا قصدت إن أنا أطول. Thallium technetium scans. Thallium is taken by both for technetium. You all know that thallium is taken only by the thyroid. You can build on that because you've known that when we were imaging the thyroid. Technetium by iodine. We've never talked about parathyroids. But thallium is taken by both. There isn't up till now a substance that is taken exclusively by the parathyroid. مفيش. لو كان في كده كان الموضوع بقى سهل. لكن there isn't one up till now. Then maybe come one. مين عارف؟ البايب لاين ممكن تكون جايبه لنا حاجه ما احناش عارفينها. اوكي؟ فيبقى هنعدي دي. خلاص؟ يلا go on. يلا لنا what's this?
This is the whole body scan.
A whole body scan. Yes, a whole body scan. It's a bone scan. مكتوب عليها ولا مش مكتوب؟ مكتوب عليها.
Yes, it's bone scan.
Because as Pradeep is saying, it could well be a whole body scan for anything else, by the way. But the bones wouldn't have been that clear. ممكن الواحد يعمل whole body scanning. Whole body scanning to detect زي ما انتم عارفين chromaffin tissue for example. أو مش عارف انتم عارفين ولا لا لسه somatostatin receptor scintigraphy. When you want to look for a net. A net, what is a net? What is a net? Neuroendocrine tumor. Or neuroendocrine tumors, irrespective of the nature, will show what we call somatostatin receptors. We get an SRS, a somatostatin receptor scintigraphy, and you locate a tumor of the net type. But this is a bone scan. What do you use for a bone scan? Technetium alone will not go to the bones.
With phosphorus.
Phosphonate, diphosphonate, bisphosphonate. Technetium alone will go to the thyroid, to the salivary glands, to the gastric mucosa, to the testicle, but it won't go to the bones. Alone it won't go. فاحنا بنعمل ايه؟ بنجيب ال MDP. The MDP wants to hide, but then we convince the MDP that technetium is its friend, and they walk hand in hand until the technetium, until MDP finds out that technetium will betray it. Betray it ليه؟ لأن هتوديها راحوا فين؟ The technetium wanted to hide, as the MDP wanted to hide, did not want to show. بس حطينا لها مع technetium عشان تخونها. تقول لها بصوا أنا رحت في العظم. If you give MDP alone, the bones will not show on a CT scan because MDP does not emit gamma rays. But you combine both together and then they become called a radiopharmaceutical. احنا طبعا بنعمل حاجتين دلوقتي. You're talking about CT scans and parathyroid at the same time. ما فيش الصوت فيه مشكلة؟
لا كويس.
طب خلاص المايك شغال بس هو مش شغال طبعا وخلاص مش مهم مش هنشغل. So this is a CT scan of the bone. CT scan, radioisotopic scan of the bone. طبعا كلمة scan alone is meaningless because you talk about an MRI scan, a CT scan, ultrasound scan. You cannot just say scan the body. Scan the body. يعني I don't know what does this mean. CT scan, radioisotopic scan, radionuclide scans, nuclear scans, whatever. Chemical nuclear is not very friendly with the public. People not like the word nuclear because they think of nuclear weapons and things that will destroy them and so forth. بس يعني this just shows a bit of hyperactivity everywhere, which is typical of hyperpara. طبعا الhyperpara the skeleton is overactive لأنه في طبعا mobilization للكالسيوم by the parathormone. انت شفته المرة اللي فاتت؟
Doctor, and this is early or late? This is early and this is late.
What do you think? What do you suggest?
I think this is early.
Okay.
And this is the latest.
And this is late. And how about the other images? What are the other images?
This is the posterior.
This is the posterior. These are the anterior. بالظبط. طبعا early and late images. You can see that this is near normal distribution of radioactivity, but it's all more than usual. حتى البون marrow is more is hotter than normal. Around the joints, it's acceptable. Around the joints, the iliac crests and the sacroiliac joints are only acceptable. You can see the tie-like appearance of the manubrium and the sternum. منظرها ظريف قوي زي ما تكون you've tied طبعا tied the tie دي كلمة tie يعني I don't know what do you call it. Okay?
دكتور الليفت هاند ليه مش symmetrical مع الرايت هاند؟ فيها حتة زيادة.
عندك suggestion لها طيب؟ ايه suggestion لها تفتكري؟ ايه؟ بتقول ايه؟ بتقول ايه يا احمد؟
بيكون على حسب البيشنت اللي بيصور هو واقف عامل ازاي. والاثنين مش بوزيشنز.
اوكي. اتفقنا على الاوبتيميزم of the action or pessimism of the thought. If you think something, just say it out loud. Then otherwise you become a pessimist. You don't want to act because you're worried that you will be wrong. وايه المشكلة؟ مين ما غلطش يعني؟ ده الاخطاء دي حاجة مهمة جدا على فكرة. مين بيقول حاجة؟ مش لازم يكون symmetrical. Maybe the dominant hand. طب any other explanations? Metastasis. ايه؟ Its position was according to Vicious was saying that, Ahmad Vicious was saying the same thing. Any other explanations, طيب? Any other explanations for this hot spot? Eh? Tumor in this bone. Possibly. Maybe, yeah. ايه تاني؟
هو كمان صباعه عليه حاجة فمش عارفة هل ده مثلا حط من الضايع على ايده مثلا.
This is the injection site. Probably حتى الزيادة دي. This is just the injection site, no more than that يعني. يلا ممكن نكمل. خلاص this is the skull X-ray and don't be frantic يا Pradeep. Okay, is this a young person or an old person?
Young person.
Is this the pelvic X-ray? These are just the set of X-rays of someone who's with hyperpara. Okay, is this a young person or an older person? Young or old, I mean, are they skeletally mature, immature? Have they fused their epiphyses or have they not?
Yes, it's a young person because it's not fused.
It's not fused. Which age? When do the upper femoral, when does the femoral upper femoral fuse?
21 I guess.
21? ايه رأيكم 21? Is it 21?
لا الهيب كام؟
ايه؟
Less than 21 I
Less
guess.
than 21. It's not something like 18. Greater progenitor is not yet fused. حتى you can also see that even the acetabulum is not fused. Show me where is the acetabulum? Where is the acetabulum? Acetabular. There. بالضبط. It's there. It's there. The one with the arrow. Yeah. Okay. خلاص يلا كمل. يلا اوكي كمل ده كله مش يعني فوق. اوكي يلا ده لسه whole body scan with technetium 99 MDP يعني it's a bone scan. يلا ما اوكي اوكي يلا go on.
What is this?
مش عارف I don't know what this is. I don't know. يلا كمل برضه كمل. لا خلص استنى يلا. Now what's going on here?
This is a scan, simply scan of thyroid. And
You should start reading, for God's sake. Just start reading. Just spend a few seconds reading. You just read so that you appear knowledgeable. The signs are in front of you and you miss some signs. ده بيحصل لنا في الدنيا بقى مش في النهارده يوم الخميس في الباراثايرويد سيبكم منها. لكن ده اخطر ايه في signs طول الوقت موجوده and we miss the signs. We just miss the signs. And if we were careful the signs we could have done other things. يلا بتقول ايه؟ هو clearly اهو بتقول clearly اهو.
it's a scan of parathyroid early stage and this is late.
خلاص يبقى early و late و anterior اهو ويبقى
And after subtraction this one.
لا هيبقى الثايرويد باراثايرويد وفي subtraction هنا وفي subtraction. There's no subtraction. Where is the subtraction? You've seen the subtraction in area that has become cold.
Okay.
You have not, there are no subtracted areas. You judge things because you know normal, because you've seen things, because you know yourself. If it happens at all, if you've got a normal hand and you're comparing someone's hand to the normal or not, then you've got your hand. But you'll not be putting your hand beside their hand. No. بس عندكم طرق كتير قوي comparison. You may know something. You've got bilateral things. You may have seen things before. You've got your own, I don't know, hand or whatever. Anterior parathyroid early, anterior parathyroid late.
Okay.
تبقى دي ايه؟
This is a retroexternal extension of inferior parathyroid on the left side.
I'm not so sure it's a retrocell extension.
I mean ectopic.
Ectopic, ما احنا قلنا the parathyroids can be present
Anyway.
typical or atypical, but I wouldn't call them ectopic. At times the superior parathyroids will, the longer the way, the more you stray. The longer, if you're going a very long way, you may very well stray, but if you're going for a very short distance, you'll not stray because I won't stray between me and Hazim, but I can say if I'm going, I don't know where. Because the superior parathyroid will have to go a longer way, it may very well stray, but then the تحت قوي. I don't know whether this is retrocell or not, mediastinal or not, because I haven't got a mark on the manubrium. I don't know. It may be lower than normal, but I'm not so sure whether it's mediastinal or not. طبعا parathyroids at times, mediastinal, particularly the inferior ones, and they're related to the thymus, or thyrothymic ligaments.
دكتور في الباراثايرويد ما بيحطولناش على السوبرستيرنال نوتش؟
لا ما بيحطوهاش مش بيحطوها as a rule. لا.
Doctor, we can also predict by this one. I mean, this is the shoulder line. It's mostly probably it's down the shoulder line. That's why I said it's.
Okay.
Down.
ما فيش مشكلة. It's slower than normal. It could well be mediastinal. Most of the times we're not sure. وزي ما بيقولوا if you're sure it's too late. بيقولوا كده كانوا زمان بيقولوا لنا if you're sure it's too late. If you're sure it's too late. Because you're not certain of anything any time except if minimal situations. If you're sure it's too late. اتأكدنا من حاجة خلاص بقى اتأكدنا بعد ما شلناها. You've got this in mind, yes, it could well be mediastinal or the superior mediastinal. Like this is a maybe scan with an early and the late This is the parathyroid scan. It mentioned nothing about the thyroid scan. So this is with the early images, maybe is taken by both. With the late images, the thyroid discovers that this is maybe and not the iodine. It lets go with the iodine, with the maybe, but the parathyroid keeps the maybe. And adenoma, the parathyroid will still keep the maybe. The maybe or systemibi. وميبي قلنا methoxy isobutyl isonitride. Methoxy isobutyl isonitride. If you refer to any of the radiology texts, you'll find a list of radiopharmaceuticals used with different tissues. كل tissue لها radiopharmaceutical بتاعتها. احنا قلنا MDP with the bones، قلنا iodine technetium with the thyroid، وقلنا BB وثاليوم with the thyroid and parathyroid، قلنا myocardial perfusion. How do you assess myocardial perfusion? Pre and post exercise, but what substance? I mean, what substance? What the radiopharmaceutical pre and post exercise? Yes. الثاليوم وميبي. ما احنا بنقول حاجات انتوا جمعوها، بنقول حاجات زي ما بنقول collateral benefit. You're doing something, but inevitably, when you're doing something, you're doing other things that will benefit you somewhere else. So when you study something else, you may have already covered so many things about it without approaching it.
دكتور هو المشكلة ان يجي الباراثايرويد بس اللي بتاخده، احنا لقينا ما فيش حاجة الباراثايرويد بس اللي بتاخده.
ما هو الثايرويد خدتها بس الثايرويد does not keep it. It does not like it. Thyroid likes iodine technetium, doesn't like maybe. It takes the maybe and then discovers that the maybe isn't its friend. It just it expels it, lets it go, while the parathyroid keeps the maybe. If it's an adenoma, that's the late images. Parathyroid localization, it's an issue. Localize the parathyroid, target your operation. Do not keep exploring the whole neck and injure, I don't know, the recurrence and so on. The typical location of the parathyroid is the intersection of the recurrent with the inferior thyroid artery. بقى الواحد يعور recurrent، طب وليه ما يبقى داخل ويعور ناحيتين؟ طب يعور واحده، لكن يبقى داخل targeted، يبقى very small incision. And you may have اتفقنا gamma counter, a gamma detector intraoperatively in order to give systemibi preoperatively, and then intraoperatively you can detect the area of radioactivity taken by an adenoma. Hyperplastic glands will not show by a CT scan. It's only the adenoma that shows, which is fortunately the most common. طبعا adenomas are times زي ما اتفقنا بيبقوا multiple.
طب دكتور يعني النوديول اللي تحت الثايرويد دي مش بارا ولا؟
هي parathyroid طبعا.
طب ليه مكانها اتغير ولا دي different؟
مكانها ما اتغيرش، هو بس الادجستمنت بتاعت البوزيشن هي المختلفه شويه. بس هي مكانها ما اتغيرش، هي بس لو انت تاخد بالك ان احنا هنا واخدين ايمج لتحت شويه وهنا واخدين ايمج لفوق شويه بس. It's no more than that.
انا كنت فاهم اللي هو الريو ريت ده اللي هو يعني مثلا ناخد صوره وكان البيشنت مثلا يستنى 5 10 دقائق ممكن ناخد صوره ثانيه.
يعني لازم 10 دقائق؟ لا. Times is 4 hours. Times is more than that. Times is next day.
قصدي البوزيشن ممكن يختلف يعني هو مش صورتين في نفس الوقت علشان
تمام، يعني انت قصدك بتراشنايز ذا بوزيشننج يعني. تمام. صح. يعني احمد is trying to rationalize the position why did the appearance change a bit. لكن دلوقتي مرة أخيرة عشان الباراثايرويد دي عايزين نقفلها. الباراثايرويد the disease of bones, stones, bones, cyclic bones, fatigue over tones. وخرجوا عارفين statement دي. The disease of bones, stones, the skeleton becomes mobilized into the urine that forms stones. People develop abdominal pains. They're depressed and they've got easy fatigability. Cyclic bones, fatigue over tones, abdominal bones, first of all bones and stones. Bones, stones, abdominal bones, cyclic bones, fatigue over tones. Identifying it, operating in a localized form, cause of hypercalcemia. ومش عاوز اقول حاجه ثانيه زهقت. يلا show us something different.
This is a CT scan showing this is early one showing the thyroid, and this is the late. And this is showing heart nodule on the left side.
what is it again? What is it?
It's maybe adenoma.
It's not maybe, it's an adenoma. You can see that the thyroid lobes, which are seen maybe on the monitors that are on your right and left hand side, the ones that are not so magnified, you can see that the upper pole and the lower pole are already gone, and it remains the nodule in the middle. The other side is, it's almost gone, but there's still a bit of hotness there. These are the early images. These are the late. Okay, يلا show us another image.
هذه ثايرويد؟
لا دي مش ثايرويد، دول باراثايرويدز كلهم. ده كله باراثايرويد. يلا سيبك من دي، ده كله باراثايرويدز، ده كله بي سكانز. يلا سيبك من دي، يلا go ahead. Forget about it, يلا. Forget about this one as well. Okay, go on. Yeah, go on, tell me what's going on. لا خلاص بقى go, tell me what's going on here.
This is the X-ray of the leg.
An X-ray of the leg, yes.
And this is the anterior view and this is the lateral view.
Anterior view and the lateral view. دايما two planes. You never get one plane because otherwise you don't know. The thing that you've seen is anterior, middle, posterior. The two views, the two planes of radiology is a major shortcoming, because the body is 3 planes, it's not 2 planes. So you can imagine that it is very bad to get only 2 planes.
And it shows a lytic lesion on the tibia, in the middle shaft of the tibia.
Okay, we that there is a lesion that is lytic in the middle of the tibia. Okay. And what is it doing to the surroundings? What has it done to the surroundings?
This one?
You mentioned that. Is it full thickness? Is it taking the full thickness of the bone?
Yes, it's taking the full thickness.
Okay. It's lytic. Okay. Are there any sort of dense lesions within it? Within the lytic lesion, are there denser areas?
This one?
Areas of density, yes. How about its outline? What's happening to its outline?
Outline is regular.
Okay, but how about its density?
It's hyperdense.
Outline
is hyperdense.
Hyperdense. And what is it doing to the cortical bone?
Cortical thinning out.
Thinning. In the context of hyperpara, how do you call this? In the context of hyperpara?
It's a bone, it's a syndrome,
A lesion, this lady or this woman had a hyperparathyroidism, this was her X-ray, and this was the presenting symptom. This was the presentation. Bone pain, the lesion, the tibia, before they ever knew that she's got hyperpara. But then the density of the skeleton is all osteopenic and there's no good differentiation. The cortex and the medullary cortex is much thinned. فطبعا they checked her calcium and they proved to be that she's got hyperparathyroidism. How do you diagnose hyperpara? Laboratory wise, I mean.
We will see parathyroid hormone level and calcium.
Sorry?
Parathyroid hormone level and calcium level.
Yeah, I mean, what do you expect to find with these things?
Parathyroid will be high.
Yeah.
And also there will be hypercalcemia.
And then you call this, if one part of the bone, in contrast to the CT scan that you've seen a while ago, is really affected and it's becoming lytic, expanding the bone. When the bone expands, when you touch it, eggshell crackling, get the feeling of eggshell crackling. It crackles like when you're trying to eat a boiled egg and it sort of crackles when you're breaking the shell. اسمها ايه؟
Eggshell.
يبقى اسمها ايه؟ This lesion, how do you call it? A very localized lesion of hyperpara. We call it osteitis fibrosis cystica. بيسموها osteitis fibrosis أو according to Abdurrahman, how did they call it Abdurrahman the other day? The brown tumor of hyperpara. According to him, مش دعوة هو اللي قال، أنا ما أعرفش هو اللي بيقول. The brown tumor of hyperpara أو بيقولوا عليها generally speaking osteitis fibrosis cystica. osteoitis, fibrosis cystica. These cysts can develop anywhere. Obviously, you can imagine that they can cause bone pain and pathological fractures, and they can cause a lump. ورينا كده لو لها CT scan. ورينا. I think you'd rather go. يلا قول لنا what about this one? Sorry, can you just get the other image before we comment on that? Note her name. Note her name. Don't mention her name, but note her name. Note her name. S-A-S. Do not mention her name, just in case someone knows her and he goes and tells her, take care, they've been reviewing your images and everyone knows that you've got hyperpara. ممكن يحصل كده. يعني نظريا. يعني نظريا this may happen. Who knows? لكن طبعا this will not happen realistically speaking, at least in this context. Did you note her name?
Yes.
طب يلا get the image بقى that you've seen. اهو it's the same person or not the same person? مش عارف.
The same.
Same? طب خلاص. Okay, it's the same person. يلا what's wrong بقى with this? يلا قول لنا ده ايه? What's happening here?
This is maybe a scan, and
This is an EB scan.
parathyroid, and it shows
طبعا in real life situations, you know the individual know their scans, but there isn't any guesswork about what sort of image this one. عادي يعني مش هنخبي بقى الصور نقول ده بتاعت مين هنعمل ميكس اند ماتش دي بتاعت مين دي بتاعت مين. It's very straightforward, but in exams it's not like that. So in exams, images would be best provided with history telling you something about the individual, not just the A وده مش A, making a quiz out of these images. يلا early with late, what's happened in the late? What's happened in the late?
later we see this one, one nodule.
This one nodule, which is an adenoma of the parathyroid again.
Yes.
This is the full spectrum. This woman had this, she presented with a bone problem. She may have sustained a pathological fracture, which she did not. She may have bone pains, but the lesion was thought to be even metastatic. But obviously this is, ده مكان common للميتاستاسيس. انت بتاعت الاكزل سكيلتون مش انت بتاعت الاكزل سكيلتون كل شويه تقول لك اكزل سكيلتون ميتس target the axial skeleton. It's the axial skeleton they target, but they're not the appendicular skeleton. Appendicular اللي هو الابندكس اللي هو يعني الايه مش عارف appendicular يعني انتوا اكيد عارفين. اوكي فيلا ورينا بقى اذا كان في سنتي سكان of the bones. خلاص this is parathyroid adenoma. لا استنى دي تاني. يلا هي what's going on? You're going frantic. Why are you going frantic?
No, I thought you said to stop at the
لا I want I want this one. يلا tell me something about this one.
This is also scan. This is
They're all CT scans, yes.
and it shows the thyroid.
ما مكتوب تحت اهو مش مكتوب تحتها.
Yes.
Thyroid ايه؟ Technetium 99. The parathyroid does not take technetium, it just takes the thallium. But unfortunately, the thyroid also competes for thallium. Right? What happened when you subtracted?
And it shows cold area.
Cold area. في parathyroid adenoma?
No.
There are no parathyroid adenomas. This is a negative subtraction scan. ما فيش parathyroid adenomas. It was not like the other one where you've seen a hot spot somewhere, I don't know, inferior left. There's nothing.
هو الصورتين اللي على الشمال دول ايه؟
ما واحدة منهم بقى الثاليوم
اللي فوق الثانية.
وواحدة منهم مش عارف لكن anterior mediastinum مكتوب. They're imaging the mediastinum just in case something lies in the mediastinum. Parathyroids at times lie in the mediastinum. واتفقنا that the third pharyngeal pouch will give the inferior and the fourth will give the superior. It's very interesting that the higher one will go to a lower level and the lower one will go to a higher level. اللي فوق بتنزل لتحت واللي تحت بتفضل فوق عشان بس كل واحدة تبقى ايه تبقى مطمئنة. انا كنت مرة superior بقيت inferior كنت مرة inferior بقيت superior مفيش مشكلة. طبعا في مشكلة بس هنعمل ايه يعني. This is a negative subtraction scan compared to the other one. عشان الواحد يبقى عارف subtraction scans, but maybe these are more updated. These may not be as commonly used nowadays. الفكره انه الواحد يبقى اولا شاف سبتراكشن، ولما يقرا ثالث تكنيشن يبقى اوريدي شافها، فيبقى الموضوع بالنسبه له اسهل بكتير. ورينا بقى سيتي سكان. I don't know, I think you should.
Okay, this is the lateral view of mediastinum.
It mentions anterior. It doesn't mention that. It mentions anterior. Why do you think it's a lateral view? Would the standard be like that? I think this is the anterior, just like it mentions. I think so. Go backwards, please. I want to show you. Go backwards. كمان backwards بس أيوة. Go backwards. Wait بقى. يلا go on. Go on with the bone CT scan. With the bone CT scan. يلا. Bone CT scans. طبعا you call this at the beginning the whole body scan because you may be imaging only part of the body. You may image the whole body, looking for, like you all know, the thyroid. If you want to detect thyroid metastasis, you will scan the whole body using something that is taken by the thyroid tissue, which is iodine. And before you do that, what do you do? What do you do before you do that? It's up to you give them recombinant TSH or you deprive them of the thyroxine so that these metastases become avid. They become avid. Their chance of taking the iodine becomes maximal. Like this is a bone scan, MDP. MDP, what does the MDP stand for? MDP, methylene diphosphonate. MDP is methylene diphosphonate. Bisphosphonates, diphosphonates are the standard medications used to treat osteoporosis, but they're also the standard medications used to treat hypercalcemia. Hypercalcemic crisis is a very serious problem, and it develops when someone's calcium exceeds something like 14 milligrams %, and then they may be treated using diphosphonates. Hypercalcemia is a crisis, a potentially fatal crisis. زي كل الاندوكراينال tumors, as the diseases, thyroid crisis, myxedema coma, hypercalcemic crisis, hypercalcemia causes suffocation, Addisonian crisis, diabetic ketoacidosis, hyperglycemic as the hypoglycemia, volume crises. If you imagine, where is the pathology?
It's in the left leg.
It's in the left leg,
In the shaft.
In the shaft of the tibia. Well, this obviously corresponds to the lesion that you've seen on the plain film a while ago.
Yes.
It's the same thing. CT scans will never miss, but all lesions will show the same way. If I did not diagnose what's going on, it just diagnose that there is something, whatever this something is. Like an X-rays will show the nature of the lesion, but they're specific, but they can miss lobes because they cannot show things unless they are big enough. But the CT scan will never miss. It will never miss.
We have also the lesion here.
We've got also something here, probably.
الهاند والريب.
ما الهند غالبا ده مكان الانجكشن سايت.
طب الريب
ده مكان في الريبس.
احنا قلنا الاستياط
If this were someone with breast cancer, what would your diagnosis be? If this was a CT scan for someone with breast cancer, what would it? Metastasis. Metastasis. And suppose it was a man with prostate cancer.
It's also metastasis.
They're mets. It's circumstantial rather than histopathological. If you encounter hot spots on the CT scan, their nature depends upon the whole situation. If you're dealing with a malignant tumor and you encounter these appearances, they're invariably mets. Some mets are very unlikely in the foot and very unlikely in the tibia. They're very unlikely. They develop, like Noor was telling us, I don't know, in the skull, axial skeleton in the spine, ribs, manubrium, vertebrae, and shoulder girdles, upper ends of the humerus, and femur and humerus maximally. You never encounter a metastasis in the hands of the feet, or this the tibia and the fibula, or the humerus and radius and the ulna. These are very, very unusual sites. طبعا they can develop, but these are very, very unusual. كله يبقى axial skeleton. يجي axial skeleton. انتوا عارفين دلوقتي لغايه دلوقتي the breast and thyroid spreads to the bones.
لو حصل هايبر باراثايرويد كارسينوما هنعرف ازاي طيب دي ميتاستاسيز ولا ديبريشن في
مش عارف، عاوزين بابسي بقى خلاص هنا عاوزين بابسي. بتعقدنا الموضوع. Parathyroid adenocarcinoma is unknown. It's very 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 unusual. If you're in the endocrine surgeon, you see one during your career, it is something. Parathyroid adenocarcinoma is very very unusual. فيبقى حتى احنا مش هنعرف عنها معلومات كتيرة عشان نعالجها كويس. It's a very unusual thing. وزي ما انتم عارفين parathyroid glands in this situation you would go on at times you biopsy a bone lesion because you don't know. At times in controversial situations you can very well biopsy a bone lesion. But مش عارف انت قول ايه.
دكتور معلش هي ليه طيب طالعه هوت يعني؟
بالظبط مش فاهم هي ليه خدت
كلها هوت. كل ليجنز فيها هوت، فيها increased turn over والبايفوسفينز بيروح على الحته اللي فيها increased turn over. فكلها هوت. All bone lesions on the CT scan appear hot. It's very very unusual. Maybe multiple myeloma will not appear hot. لكن all bone lesions appear hot. عشان تبقوا مستريحين بس من الأول. Bone lesions on the CT scan will all appear hot. They will all appear hot. They will all, whatever the nature. عشان كده بنقول إيه, they're sensitive but not specific. Because the lesion on a CT scan may turn out to be anything. But a CT scan will never miss. If you want to say that there are no bone diseases, you get a CT scan. You don't get an X-ray. You don't get a skeletal survey because a skeletal survey may miss upon so many things. But if the CT scan says it's negative, then this is ده المنتهى اللي هو بيقولوا عليه الايه يعني الالتيميت. مفيش حاجه بعده خلاص. ما عندناش حاجه ثانيه نعملها بقى. خلاص يبقى I hope خلاص these are بقى the rest of the things. I hope that this topic of parathyroids and this sort of thing is gone. يلا كمل يا كوليج, go on. يلا show us بقى what that is.
This one? This image or
this image.
it's a MRI.
MRI. This, you think it's an MRI? Seriously?
Because I
في
You
بون
really think it's an MRI?
في بون يعني.
it's bone. It's a CT.
It's a CT.
Yes, it's bone. Yes.
But he was confused. He did not stand strong enough. Yeah, this is MRI, it's not a CT.
No, doctor, we can see the bone here. That's why I.
Yeah, but it's the medullary bone only that you can see, and you can see how the subcutaneous tissues are really high signal. Can you see the subcutaneous tissues? Okay. So, what is it that you can see?
We can see the kidneys.
The kidneys, yes.
And this one. What is this? It's a lesion in kidney or hypertension.
You think it's a region of the kidney? You really think so? You really think it's a region of the kidney? Is there a vein between it and the kidney?
It's maybe intestine.
Maybe, sorry?
Intestine.
Intestine? You really think intestine will lie?
ادرينال بقى.
Maybe it's intestine. What else do you think it could be?
It could be adrenal also.
It could be adrenal.
Yes.
It's the adrenal glands. It's the adrenal gland. This is now it shows the adrenal gland on which side? Is it the right or the left?
It's the right side.
It's the right side.
Right side.
It's the right side.
مش ريتد قوي الاناتومي هنا.
ايه؟
مش ريتد الاناتومي هنا.
ايه؟
مش ريتد الاناتومي انا مش عارف.
هي مش الادرينال المفروض فوق الرينال فوق
فوق الكدني هتبقى ايه يا رب؟
لا هي ناحيه
دكتور يعني هي مش فوق الكدني يعني المفروض تبقى في الكت اللي فوقيها مش
بالظبط.
طالعه معاها في
ناخد
نفس
كاتس
الصوره.
فوق نلاقي الادرينال لما تيجي كده ناحيه ميديا.
هي معلش هي الكدني عامله بالظبط. تعالي هنا. هي ايه اللي انت قاعده تعمليه ده؟ مش فاهم. بتعملي حاجات غريبه قوي. هي رول يعني واتس جوينج اون
الادرينال مش يعني هي
بالظبط. المكاره هي عارفه الادرينال مش دي عامله كده ودي عامله كده. هم عاملين كده. فممكن قوي الواحد يقطع مقطع يلاقي دي مكاره جدا لانها عارفاها كده. She does not need to think about it. She's spontaneous. لكن who cares? Spontaneity may be overcome by a lot of work. يعني هي spontaneous في حاجه. طب ايه المشكله يعني؟ اكيد انا spontaneous في حاجه ثانيه. انت اي كلام من غير. لا كنت كويسه بجد. كنت خياليه because you know it just like that. فيلا ورينا كده. لا استنى بس. show us what vessels can you see. يلا go on. show us there are a few vessels that you can see here. يلا there are vessels and what do they appear? What density do they appear? طبعا this is not an MRI session. MRIs need a lot of work, بس this is not an MRI session. بس بالمرة هنشوف حاجات في MRI. MRI طبعا stands for magnetic resonance imaging. It used to be called nuclear magnetic resonance because people worried about the nuclear part. We've already عملنا ايه في replaced بالظبط بالnuclear magnetic resonance. Okay, and sometimes can you use contrast in magnetic resonance in MRIs?
Yes. Maybe.
What contrast you use?
IV.
IV, okay, IV, but I mean, what is its nature? Yes, IV contrast, but what is its nature? ايه صح اقول ايه؟
جادوليوم حاجه زي كده.
جادولينيوم. Absolutely, gadolinium. The contrast it uses gadolinium. Or gadolinium is it safe a substance to give? Yes. How's it in country? ايه يا سيدي في ايه؟ بتقول ايه؟
بسيط بس يعني لو كان في رينا impairment ممكن يعمل نيفروجينيك سيستميك سكليروز.
مكار. Contrast it inject in CT is well known to cause renal impairment. حتى بيقولوا contrast induced nephrotoxicity. And do not think that MRI is absolutely safe, because if there is renal impairment, it may very well cause what we call nephrogenic systemic sclerosis. انتوا كلكم عارفين as a general rule that if you request CT with IV contrast, you need to check the creatinine before the IV contrast. دي حاجه كل الناس عارفينها.
انا في دماغي ان الجادولينيوم يعني مور او يعني سيفر ذان
ما هو بس it's not 100% safe زي ما المكار ده عارف او المكار ده عارف زين عارف that even MRI, if you can use MRI without contrast, fair enough, but if you give gadolinium, you're worried about what we call nephrogenic systemic sclerosis. But it's not 100% safe. It may be a bit safer, yes, but it's not 100% safe. So if you've got someone with nephrotoxicity, I mean with renal impairment, you've got to work out what contrast you're going to give, if you're going to give contrast at all. If you're going to consent them, if you're going to give them, how would you improve the renal functions pre-contrast?
To improve renal function, pre-contrast.
Yes, I mean, dopamine. There is something very simple. If you want to improve renal functions, what do you do? أنت محمد? Muhammad, what would you do if you want to improve renal functions? What do you do if you want to exercise? If you want to get بس كده. بس you hydrate people. Yeah, people who are dehydrated are very prone to renal damage. People who are well hydrated are not as prone to renal damage. ومعروف, hydrate people. If you're worried about the kidneys, hydrate people before they go into a pre-renal or even a renal failure. انتوا عارفين if someone is dehydrated by time, they develop at first pre-renal failure, but if it persists, it develops into an acute tubular necrosis, into a renal failure. فبيقولوا hydrate. Is there any? How do you, if someone is already taken a lot of paracetamol, how would you antagonize the effects of paracetamol?
NSAID.
Sorry?
NSAID. I mean, we are
And then say N-acetylcysteine. It's the antidote for paracetamol, which is a very popular drug. But sometimes people decide to not to continue living and they ingest a lot of paracetamol. And if you want to save them, you give them N-acetylcysteine. Why am I mentioning N-acetylcysteine? Suddenly, am I gone mad or?
It's related to the vasculature of kidney, especially efferent and efferent arterioles.
N-acetylcysteine may improve renal functions. He knows something about it. We can give N-acetylcysteine in the form of sachets in order to improve renal functions or third mechanisms. But N-acetylcysteine is well known. Yes, it's a expectorant. It's a mucolytic. Well, it's a very famous medication because you also use it in people who are born with I don't know what. بيبقى عندهم ايه اللي يجي لهم نديلهم انسولين يداوي بالميوكوس بتاعهم مقارة cystic fibrosis, mucophysidosis ولا ما اعرف اسمها ايه كان. It's well known اهو. And acetylcysteine. You want to improve renal functions. Zain was telling us something about nephrogenic systemic sclerosis. Beware gadolinium before you give IV contrast. You need to check the renal functions. طبعا urographin and all iodine containing are hypertonic and they're nephrotoxic, and you have to exclude. The radiologist will not allow you to get an image with IV contrast unless you've already provided them with the recent level of creatinine, otherwise they will decline your request. خلاص؟ فيلا قول لنا بقى how about these vessels? There is a vessel that is very prominent. يلا I'll show you what ولا go on the image in the middle. The image, أيوه what is this artery ولا vein ولا I don't know. This is the aorta and it's what signal is it? Hyposignal. Yes, low signal. In fact, there is no signal at all. When there is no signal, when there is an empty area, how do you call it? Void. Void is empty. Void مالهاش دعوه بالطب ولا دعوه بالام ار ايز خالص. Void is empty. Void. Signal void. 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 دي كلمه وحشه قوي على فكره. وحشه قوي. الامتي ده وحش قوي. فايتس void. It's a signal void. Unless you want to get بقى an MRI without contrast and you concentrate on the vessels, this is different. But on an MRI, on an ordinary MRI, I mean an MRA, you're getting an MRA. But on an ordinary MRI, it will appear usually a single signal void. And this is the aorta. How about the vessel close to it? How about there's another vessel that is sort of I don't know, flattened or not flattened. I mean, how do you call it? Compressed. Well, I don't know what. Vessel close to it. What do you think it could be? The IVC. Have you got any doubt? You've got any doubt about it being the IVC?
No, because it's compressed. No.
Yeah, you haven't any doubt. Or have you got any doubts?
No, in
No.
this case I think.
Okay.
دكتور
Moreover, it's a right side, so it should be.
Bravo, Ali. Yeah, it's talking about in order to identify a structure that you do not know, identify whether it's right, left, anterior, posterior, I don't know, medial, lateral, and its density and its relation in order to reach most probable diagnosis. You don't just rush to something unless you know it offhand. You may know things offhand or not. If you know things offhand, go ahead. You may be right, you may be wrong. If you don't, just give it a second thinking about it, whether this is the thing that you're talking about or not.
دكتور not right to left ازاي في الأمر؟
Answer, I don't know. Noor is asking a question.
Usually-
Probably her,
Usually, MRI or CT is taken.
what's happened to her illumination at the moment? Has something gone wrong with her illumination?
Maybe because.
Maybe because she's asking, Allah رد. انت يعني طبعا انا respect Noor far more than I can say. She's يعني she always takes the initiative. She knows a lot of things. وكل شويه تاخد initiative ما بتخافش من اي حاجه خالص الحمد لله. يلا يا Pradeep, tell her what about.
Usually, CT, MRI are usually taken from the left, foot side, foot to head side. That's why this is projection line.
How is someone lying when you're imaging them using a CT or an MRI? How are they lying? Are they lying on their back or on their?
Supine.
Yes, supine position.
خلاص؟
And image from the.
يعني it's the same as CT.
Yes.
It's same as CT. You're interpreting from the foot end and they're lying on their back and they're supine and that's it. But this is the right and this is the left.
Yes.
As a general rule, in the early days of CT, it was a bit confusing because they did not standardize that except a bit later. They used to mess up things. This is right side or the left side. But nowadays it's all standardized. يلا عشان نخلص
دكتور
بس.
دكتور هو ايه الابيض اللي قدام البارف اللي قدام الادرينال؟ ايوه ده
يلا what sort of أبيض what is أبيض?
White.
What? I know أبيض white. I want to say another term. MRI
سيجنال هاي سيجنال
with X-rays, you're talking about 3D lucent, 3D opaque. With the CT scans, you're talking about hot, cold, and warm. With ultrasound, you're talking about echogenicity. With MRI, you're talking about signal, and the CT, you're talking about density. And the first thing that you describe a lesion on any of these is it's how does it appear, whether it's dense, whether it's echogenic, whether it's cold, whatever it is. طبعا its location and its appearance. Yalla, give us what could this be?
It could be.
ممكن تكون تستنى لوب مثلا.
طب مش معنى اللوب ده اللي ظاهر
Any ideas?
Colon.
It's Mets or.
Mets? We're talking about anatomy. We're talking about
ممكن
anatomy.
الجسد مثلا تستنى
إيه؟
لوب او حاجه.
إيه؟
ممكن تستنى لوب.
انت سامع لوب بتقول ايه؟
مش ده الليفر
بتقول جول بلادر؟
بلادر.
جول بلادر.
اللي جاب الجول
ده هي الجول بلادر زي ما بنقول.
بجد.
This is the gall bladder and this is what we call a T2 image. بس انتوا لسه ما عرفناش ال T2. T1 images on the T2 fluid will appear high signal. On the T1 they appear low signal. So this is in fact the gall bladder. It's انت ايه جول
الليفر بقى اللي حاجه
بس
هاجمني
كده هو اللي قال كده. قال ده الليفر يبقى ده الجول بلادر. يبقى this is how you identify things even if you don't know. Do have a look on imaging anatomy. It's amazing. مش حابينها؟
مش حابينها بس
مش حابينها مش فاهم يعني. إذا حد يطول يعرف أجزاء الاناتومي. Do you not like imaging anatomy?
I like it a lot.
You like it a lot. It's just you're just complimenting what I'm saying.
I really like it.
So this is a very thoughtful individual. يعني he's extremely thoughtful and he's extremely well read and knowledgeable. يعني I envy him a lot because he's got so many great traits. يلا قول لنا بقى there's something that joins. يلا tell me.
This is the renal artery.
Renal artery. Do you really think so? This is the renal artery. Do you really think so?
Yes, it's coming from aorta.
Maybe. But I'm talking about something. Also, I'm talking about something that comes from the left kidney into the cava. On the image on the second row, your right hand side. What's this structure?
This one.
It's
It's a renal vein.
It's the renal vein.
This is renal vein.
The left renal vein that we're talking about the other day. شايفين left renal vein? We're talking about how the left renal vein is very long and the right one is very short. شايفينها and how it crosses in front of the aorta.
Very
You should be يعني top entertained. يعني لازم تصنفوا الحركة دي بتوب entertainment. ما فيش entertainment خالص. ده لازم تبقوا top entertained. لو خدتوا سكور from 0 to 10 هتقولوا 10. يعني IVC aorta left renal vein. What more? The gallbladder. T1 and T2. He didn't stand strong enough in front of a question of CT or MRI where he changed his mind when he was correct in the first place. Did you not do that? You did?
Mistake, yes.
Yeah, it wasn't a mistake, yeah, but you don't take things very seriously. Don't be very sensitive. And I like being sensitive, but how about these two vessels? How about these the ones in front? ايه دول تفتكر؟ What are these?
اللي قدام خالص دول؟
أولاً, could you see a vessel arising from the anterior surface of the aorta? Yeah. Could you see a vessel arising from the anterior surface? Move to your left hand side. Yes, go on. Is there an artery? Artery arising from the front of the aorta?
This must be IMA inferior.
This is in the IMA. Do you want to change your mind? Yalla, go on. Yalla, what's happening then? This vessel has started from the aorta and then it's gone down. So you can see how beautiful the image is. Yalla. And it's present in front of the left renal vein. The superior. This is the SMA and the SMV. مش هنكمل حاجة بعد كده. انتوا بس هتتأملوا في الاناتومي دي. This was how do you call it, a pheochromocytoma of the right adrenal gland. The one that we're mentioning the other day. بس جيب فيلم يمكن عندنا فيلم هنرجع ليه تاني حالا بس جيب فيلم كده تاني. Obviously this is the one that has been sort of I don't know what. يلا go on تاني. أيوة يلا لا هو the magnified images. Yes, go on. What are these? طبعا they're the same individual. يلا go on. What are these?
This is the coronal.
مشكور جدا. أنا خلص اللحظة دي. يلا.
And
this is a
coronal section.
This is a coronal section.
Yes.
Coronal?
Yes,
coronal? Are you sure?
Yes.
This is the coronal section. Where is the kidney? Right kidney.
This is
صح.
the right and this is the left.
Right and the left. Does this conform to anatomy? Does this appearance conform to anatomy?
Yes.
Which kidney is higher?
The left.
The left kidney. And what are the source muscles?
So this should be
Here, pretty both strong. Yes.
this is
The ones on both sides of the vertebral column. The renal theo. Where is the theo again? Where is the theo? Where is the adrenal gland? Yes, it's this one. Absolutely. This is the coronal view. طبعا MRI has got the great advantage of imaging in any plane. زي الالتراساوند. Any plane. CTs reconstruct the different planes. But this is an original image and it can image any plane. ودي ادي الايه كورونا وادي الاكزل. نرجع الاكزل ثانيه عشان نبقى done بقى today. I hope that you enjoyed your session this morning.
بس يا دكتور مش
Thank Aisha again because she's pressurized herself in order to be with us. انتوا طبعا مش فارق معاكم خالص، اللي بريشرايز نفسه بريشرايز، فاشكروها. طيب اعملوا اي حاجه، بس هي برضه. طب هي تعمل ايه بالشكر ده؟ لا تعمل طبعا، هيساندها وهي حاسه انها بريشرايز، فيقوم ده يجي على ده، يقوم البريشر ده كله يروح بس. يلا get the images back, we want to get done. يلا يا Pradeep, what's going on?
في اكزيال.
يلا we want to get the images.
الاكزيال.
جو باك
يلا مرة
كمان
oh, very interesting image. One last thing, يلا there are two vessels there. There are two vessels. The one to your left hand side, the bigger one is the SMV, and the one to your left hand side, and the smaller one is the SMA. SMV and SMA and SMV. Where it's like that. اللي هو
دكتور كبير الارتري ولا الفين؟
الفين الاكبر، الفين اللي هو to the right hand side. The veins are on the right hand side and the artery is to the left hand side, and it's the aorta, and this is the aorta, and this is the superior mesenteric, and this is the renal, and this is what it does. وعشان كده ساعات لو انتوا عارفين the nut cracker, if you're aware of the nut ايه nut cracker كلكم عارفين nuts and the nut cracker where you put the nut and you unfortunately you crack the poor nut, and the nut cracker المشهور قوي. خلاص يبقى بالظبط we'll stop at this point. You were great. Thank you very much. He was great.